Hello, I'm Dr. Donna Willis for the Learning Channel. You're about to see bunion surgery. Bunions are no joke. 7 million Americans will tell you it's like walking with a rock in your shoe. Our patient Norman Goodfriend experiences this kind of pain every day. He has a bunion, an inherited and extremely painful condition in which the big toe joint moves out of line and causes a large bony swelling. Norman's an avid hiker. The more he hikes, the worse his bunion gets. Traditional bunion surgery would have disabled him for months with no guarantee of long-term relief. Eager to be rid of his pain, Norman consulted Dr. Allen Selner. Dr. Selner's innovative technique not only removes the protruding bone, but also realigns the joint. Let's join Norman and Dr. Selner for this delicate piece of engineering on the operation.
When I'm not doing the lawyer, I like to escape. I like to get out to the Sierras and hike. I hike here locally every morning, or try to every morning, before I have to go in and practice law. It's just nice to get back to the nature of things after spending so much time in the concrete here in L.A. It was in about 1984 that I had surgery done on that toe to remove a benign tumor. And it was done by an orthopedic surgeon, and he said that it looked like I was developing a bunion in that toe. My bunion mainly affects me in the fact that most of the time I'm hiking with pain in my foot. Sometimes it'll be where I'll flex it and the pain will like shoot right up my leg, and I'll actually have to stop hiking.
Norm, how you doing?
Oh, pretty good.
Great.
Pretty good.
Let's take the shoes off for me. And what we're going to go over today...
I actually saw Alan the first time because I was having tremendous back pain, and my orthopedist said, maybe it's your feet. And I went to see Alan, and he fitted me with some orthotics. And at that time, when Alan x-rayed my foot, he said, aha, I'm going to see you someday and have to do something with this toe, and that day has finally come.
Okay, Norm, now, this is your foot, okay? Your left foot, your right foot. The problem here is that your joint is out of alignment. Instead of being straight like all these other toes, like a normal foot, your metatarsal bone is way off like this, and it's all genetic. I mean, you didn't do this. Tight shoes didn't do this.
What is that cloudy place?
What, here?
Yes.
What this is a little round bone called the sesamoid bone. And actually, there's two of them. There's one over here and one over there. And it's normal to have them. It's not abnormal to have them. Because you know what? There's a little muscle right in those two bones that goes right under your big toe, and that's the muscle that pulls your big toe down. But your big toe, because those bones aren't in the right spot, the muscle is pulling the toe to the side. And that's why this big toe keeps drifting further and further in this direction, because this muscle is not lined up. It's like a bowstring. Well, a bunion, the true term bunion, means turnip or bump. And the bump is really the arthritic bone on the side of the toe. But what's interesting to note is it's not the bunion that's the problem. What you have to say is, why did that bunion get there? The bunion gets there because the joint is crooked. And it's that crooked joint which causes malalignment, maltracking of that joint, that keeps banging those bones into each other, and the arthritic bump forms. We know we've got a crooked joint, and we know we've got an arthritic bump. Here's the arthritic bump right up in here, and this is all arthritic bone. And so we are going to clean that off. But that's not enough. Let me show you what we're going to do. First, we're going to cut the bone right about here. I'm going to cut the bone, and I'm going to slide it over like that. Once I slide that bone over, I'm going to slide it on top of these two little bones so it's sitting dead center over the top of those two little sesamoid bones. Now when I do that, what that's going to do is it's going to take this crooked toe and it's going to make it straight. Norm, this is where Star Trek meets foot surgery. This is Derek, our biomechanist.
Nice to meet you,
Derek
Norm.
is in charge of this whole human performance lab. And what we're going to do here is measure all the pressure on your feet. You know, people don't realize how complicated gait is. When you walk, your heel hits the ground, foot comes down, and you bend your foot and you push off. If you can't push off, you're in deep trouble because you got to lift the limb through. and limbs are heavy. So when your big toe doesn't work right because the big toe doesn't bend, you put a lot of stress on your back. And consequently, there's so many people who have back pain related to the way they walk.
If you'll shift from heel to toe, you can see the pressures change, and perhaps you'll see the red and white spot. That's the balance point, moving forward and backward. Now shift back to your heels again.
Okay, now Norm, what we see here, this is the summation of all the pressures on your feet. The red spots are where you have most pressure, and the other lighter colors are less pressure. And what's important here is you can see a couple things. One, you're bearing a lot of weight on your big toe. You're supposed to bear weight back at your big toe joint, but you're grabbing with your big toe, and the reason you're doing that is because your joint isn't working right. And it's actually on both feet that you're doing that. You're not getting enough weight on the big toe joint back here. So when I get done with this, I'm hopeful we'll bear more pressure on that joint so that when you walk forward, the weight is distributed evenly across the ball of your foot. I could never stand the sight of blood. My father, who is a foot doctor, never wanted me to become a doctor. I passed out at the sight of blood when I was young. And people always laugh at me because he was worried that if I was going to go into medicine, what was going to happen when I became a surgeon? And the first time I saw surgery, I almost bit the dust. I mean, you have to walk out of the room. It was tough because, you know, you think you're hurting somebody. And once you realize you're focusing on what you do, you get by. Norm, this is my brother, Dr. Mark Selner.
Nice to meet you. It's a pleasure to meet you.
We do all of our surgeries together. You know, I'm a really fortunate guy. I get to practice with my best friend, who's my brother. And we work great together, and I'm really lucky, and I hope it continues for a long time.